clinical trials are required to change practice because we've got to know before we change that practice that the thing we're going to change is going to make a positive difference for patients. The establishment of NCRI meant that researchers could collaborate and get advice and feedback and expert input into the trials they were developing to make sure that those trials were right, were going to provide the answers that we needed to improve things for patients. I think because NCRI was established, the quality of trials increased. Over the past couple of years, we've seen a number of changes to the way men are diagnosed or men are treated for prostate cancer. And each one of those changes, each one of those improvements has been as a result of a practice-changing trial. The three that I would particularly highlight are the PROMISE trial. It led to the introduction of MRI into the pathway, which had never been in there before. That massively reduced the harm that diagnosis of prostate cancer does and increased the accuracy that we can diagnose the disease. Then thinking about men with localised disease, their treatment has been improved by a trial called CHIP, which looked at what was the best way to deliver radiotherapy. As a result of CHIP, rather than coming 37 or 40 days in a row for their radiotherapy, men can get that treatment now within 20 days, 20 sessions, and that's hugely reduced the burden on men. The final trial that I was going to mention is in the advanced prostate cancer setting, and that's the STAMPEDE trial. It's multi-arm, which means that they can ask and answer multiple questions all at once. It's a really good use of resources. And we've already seen that trial change practice 3 times. And what that means in practice is men with metastatic hormone-sensitive prostate cancer now have 3 treatment options, all of which are extending survival that they didn't have before that trial and that they wouldn't have without that STAMPEDE trial.